is because MEERA is there with me. But otherwise, um, the the um, the last couple of years have shown to us the enormous responsibility, and I'm choosing my words very carefully, the enormous responsibility that people in this room have, and in some sense have shirked uh, when uh, when this disaster hit us. Each time we saw people walking back home a few thousand kilometers, or people dying on footpaths waiting for hospital admissions, or policemen carrying out their duties without proper safety equipment, or doctors dying, inventories running out, uh, stocks of injections running out, and then we didn't have injections themselves. Um, and not to speak of whatever happened at cremation grounds and burial grounds. Each time we saw those images, each one of us felt horribly guilty. Well, I think that is where our entire learning failed us. Um, we who were supposed to solve these simple problems with simple technology that has existed in our laboratories and in our universities for at least 20 years. We could not reach it out there, and people died. Uh, that is why I think it is so important that the Raj Reddy Center has been set up and has decided to get all of us together to take this forward, to first give a knock on our heads for us to assume our responsibilities and then to take it forward. You saw where it worked magically. When some of civil society came in to solve some of these problems with simple apps for oxygen cylinders, for concentrators. It was magical. And suddenly people were rescued just when they were dying and gasping for their last breaths. There was a WhatsApp message that went out, and somebody rushed in with a cylinder. Somebody rushed in with some injection, and we saw the power of technology in being able to save a hopelessly broken health system. You saw the same magic work in education. One of the things that people like me were so overwhelmed with was the fact that our entire teaching community, which for the last 2000 years has taught with one pedagogical system, which is a chalk piece and a blackboard, was told on one fateful day of March that from tomorrow you will shift to online teaching. Here were teachers who didn't even have their own telephones. Forget about tablets and laptops and heavy duty computer systems with cameras and whatever. But almost overnight, and most of us thought that this is hopeless. This is going to be a 0 year. It will be a wasted year. How are we going to move from blackboards that we had been using for at least the last 200 years to PowerPoint slides on fancy platforms that some of us had never heard of? I mean, so how many of us had heard of a Zoom before March 2020 or 19? And here we were almost the next week. Every single teacher or most teachers in very poor schools ready with basic slides, with classrooms on simple platforms, somehow trying to teach young students. Most of these teachers had never used machines, and they were working on shared smartphones, a smartphone they were sharing with their entire family. And they rescued, for a bunch of our students, they rescued an entire 2 years. It was technology coming out at its best and its loudest, by way of ensuring that at least a bulk of our students did not waste 2 years. We still could not help about 50% of our children or more who did not even have that one shared telephone. So in a lot of ways, this is a very, this conference is so timely because it puts this entire tragedy right in front of us and also shows us the way out. Simple, inexpensive, efficient ways out. So congratulations to all of you who were part of this journey over the last 2 years. I know a lot of you were, both in the healthcare sector, in all the three sectors we are talking about today: livelihoods, healthcare, and education. I didn't even mention livelihoods. Those millions of people who just lost their jobs, and some horribly so, people who are not even paid for work that they had done during February and March. So we were a very sad society a couple of years ago, and the only silver lining was how most of us used the technology at our disposal to reach out in circumstances where we could not have reached out physically. Three of those champions are here in this panel, and that's why this is such an eminent and such a honor to have the three of them here, who found solutions on the run and implemented it at large scale across the country. Let me, begin because the entire focus was on healthcare for the last couple of years. Let me begin with somebody who I have known for years, who did such phenomenal work in every healthcare sector, hospital, pharma, all of that. Manoj being one of our most eminent leaders in this space, and thanks Manoj for joining us today. Manoj, your take on how do we look at this completely broken system? And as Sujata Rao's famous book said, do we care? I mean, she titled it so evocatively. Do we even care for those who suffer morbidity and mortality? How do we take that, and with the few people like you and the absolutely wonderful work that you have done, how do we transform this sector? How do we ensure that something as horrible as this doesn't happen ever again?
Thanks for having me on this panel. And this is the first conference that I am attending in the physical mode in possibly 2 years' time. So, the question that you posed is something which I've been asking myself almost like every day. So if you really look at the way the health sector has been really growing, in fact, I had the privilege of being in this sector for almost like now 3 decades. So we have seen the kind of journeys that happened, and more important, the journeys that didn't happen. So, the consequence of that was seen in the worst form during the COVID. So everybody knew that health is important. Like, I've been part of various consultative meetings where we talked about how do we increase the healthcare investment from 1.5% of the GDP to 5%, and what should be the kind of focus. And some journeys happened, especially if you look at the private healthcare delivery, especially the healthcare that we have access to, especially living in large cities, has improved substantially. The hospital-based care has grown substantially. The National Rural Health Mission has again put in some infrastructure. But when we were really hit with crisis, in the month of May last year, when our own friends asked for a hospital bed, that's when we realized that how inadequate we have. When they ask for a ventilator supported bed, it's not available. And that's when actually we actually in care as an NGO, we've never run a hospital, but we said, okay, let's really put a 200 bedded hospital within 2 days. And the question was that, will we get doctors? Will we get equipment? Everything happened. So my question to myself has been, if we can really make this happen in 48 hours, why can't we really do it systematically? So there are some clear challenges when we look at the rural healthcare delivery. So of course, one always we talk a lot about it, sometimes overdo it, is the need for product innovation. Do we have the right product needed? That's one conversation which comes in. Second is, of course, is that do we have the providers? I think we have a big gap of providers. If you look at the doctor density in urban versus rural, we have a significant gap. And then the service delivery, I think that's completely broken. So if I just take one example to illustrate, I'm just moving away from COVID for a second. CARE is a large program for supporting weak newborn care babies, especially in the state of Bihar. So you look at maybe babies who are below 1,000 grams. And then how do you support that mother? So I will just narrate one field visit where actually I was with one of the mothers along with the ASHA worker and the Anganwadi worker, the frontline health workers. So actually this lady had a baby given birth some 15 days back. Baby was weighing 800 grams, survived. And then there is a follow-up mechanism which has been set up by the government and supported by us. And ultimately, this baby was not feeling well, was not feeding well. So I think the mother wanted her to be taken to a doctor. So the question was that, okay, where do we take her? Everybody was giving her advice. The nearest hospital didn't had a pediatrician available. So this place that I'm talking about is a village in the Gopalganj district. So finally, the father of the baby said, okay, I'm going to borrow the money and take the child to meet a private healthcare facility. So I think that's the tragedy. So the thing is that you don't have provider at the right place. And then how do you triage? Like, if you recognize that there is a problem with somebody at the village level, how do I work on the referral? I think there has been a lot of improvements, but I think the journey that we need to do is a lot more faster. And if you see, do we have the technology tools? I will say that we always have the technology tools. Do we have the investment? We have the investment. But I think possibly what is a missing link is the management. So I think how do we really build in the right management capacity at various levels? I think that continues to be the kind of focus that we need to really build in. Besides getting large number of doctors, that's going to be at least a 10 to 15 years journey, because we are not going to create all these providers in 15 years. But I think with what we have, how do we structure optimally the kind of delivery system? I think there has to be very solid thinking that needs to happen, because COVID is not the last pandemic. We need to be really prepared with living in a different world, and we have to really strengthen the system for that.
Thanks, Manoj. Also, thanks so much for pointing out that major gap that exists and how it can be solved. That was a very phenomenal example that, we could put up hospitals in 2 days, and we had several such come up in the most difficult areas. If we could do that, why couldn't we do it across years with millions of dollars? Again, very simple principles, as Manoj puts it, of management, of being able to deliver, and of putting systems in place. May I go over and get in Ramji? Ramji, the Agastya Foundation is very well known, has done amazing work over years in rural communities, and it is so interesting that all that Ramji and his team had done was so amenable to be used over the last 2 years, and they did it so well. We really want to know from you the lessons that a leader like you, a pioneer like you in this field, learned during these couple of years. For people like us, for poor teachers like us who are thrown into this new field, it was a difficult time. Very often one thought that maybe I'm just wasting my time talking to a laptop. And am I getting my students interested? Are they hearing me? Especially when all of them had switched off their videos. Was it a total waste of time? And how did you manage to reach out to your large group of students in difficult areas with difficult issues of bandwidth and so on. So your lessons at Agastya, Ram.
Sure. Thank you, Dr. Khan. You know, in 1999, when we started Agastya, we had a brainstorming. And we asked the question, what is the gap in the market? And is there a market in the gap? The market being education. And we were saying, why does India keep lurching from problem to problem? Why are we always reacting? Why don't we prepare ourselves to deal with problems? You know, some of the things that were pointed out by the earlier speaker. And one of the members of the group was Dr. Iyengar, the former chairman of India's Atomic Energy Commission. And he said, you know, Ramji, what India lacks at the grassroots, and actually it's across the spectrum, is what he called cause-effect thinking. We don't know how to trace the cause of a problem. And if you don't know how to trace the cause of a problem, it's unlikely you'll find a solution. So the question was, are you born with this or is it something you learn? And he said, it's something you can learn. And he said, in the West, they recognized the importance of this a century earlier. And so they began to make this formalized in the education system. Basic cause-effect thinking. So the healthcare professionals live and breathe this. If you have a headache, you go to a doctor, he or she does a diagnosis, tries to find the cause of it, and then recommends a solution. They're experimenting, they're discovering, and hopefully they find a solution, right? That kind of thinking, he said, is almost completely absent. What Nehru called the scientific temper, unfortunately, was not disseminated to the masses of India. So his point was, if we can find a mechanism to disseminate that spirit, to trigger cause-effect thinking, then we can cause a revolution in the country in a positive way. So the first thing in cause-effect thinking is you must be curious. If you're not curious, there is no question of even recognizing a problem. Now, the good news is most of us are born curious. The bad news is the education system kills curiosity. So the first thing is the education system is working against cause-effect thinking, which in its higher form leads to creativity and innovation and so on. So we have to spark the spirit of inquiry and curiosity in learning. Okay, that was the first. If you did that, there is a chance that students will learn to observe with all their senses. They will begin to experiment, discover, maybe even connect the dots at higher levels, apply all that to create some solutions, hopefully for the benefit of society. So we said this is the model that we need to trigger and propagate across the education system. The question was, how do you do it? And it seems like such a huge challenge. Fortunately, we said the answer lies with something as simple as this. It's called the Tippy top. It costs all of 10 rupees, made in Chennapatna. And the idea is if you spin it on a surface, because it sits on its bottom, at some stage it tips over and begins to spin on its stem. It is so counterintuitive that anyone who plays with this goes, ah, array, how did this happen? That question starts. And if you start investigating to find out it's not that simple, you begin to find an answer. And when you do find that answer, you experience the famous aha effect. And the beauty about this is, while you do this, you're having a lot of fun, which is the ha-ha effect. So we said the three most vital ingredients in learning and education, in fact, in life, are the spirit of curiosity, aha, the process of creative learning, and ha-ha, joy in learning. And we said for the most part, there is very little aha, if there is a aha, it is somebody else's aha. He or she found an aha, memorize it and give the answer in a book. So there is hardly any ah. It's all negative ah. No aha and very little ha ha. So how can you expect a population that has been brainwashed in this way of non-thinking to find solutions? Because it's just not asking questions. Why isn't that healthcare facility close by? Is it because of money? Is it because of lack of understanding the importance of that? What problems will that solve? What second order effects will that have? That kind of thinking is largely absent. And I have to say, it is absent not just among the underprivileged and so-called uneducated, but for the most part among the educated population who has been educated on what to learn, not how to learn. So the biggest lesson for me is, it seems like a massive challenge, but the underlying core is curiosity, the spirit of creative exploration, and having fun. You can inject this into the system in a very, very low cost way, a la the tippy top. You can spend hours. There's actually a picture on the internet of Niels Bohr and Wolfgang Pauli playing with the tippy top. And you can see they're trying to figure out the physics and math of it, right? Now, this can teach you in 1 hour or 2 hours or 10 hours, more than hundreds of hours of chalk and talk, boring lectures. So the good news is, revolutionary learning can happen at a very affordable, low cost. In fact, sometimes it requires affordable, low-cost approaches. The second thing I've seen with children, I'll tell you a story. Some years ago, 2 girls, Rani and Roja, were sitting under a tree in Andhra Pradesh on a hot summer's day. I grew up in Rishi Valley and I sat under a lot of trees and I climbed a lot of trees. But I never asked the question that Rani asked Roja. And Rani asks Roja, do you ever wonder, Roja, why you feel cool or cooler sitting in the shade of a tree? And Roja says, maybe it's because the leaves and branches shade us from the sun. And then Rani asked the question, eventually, do you think different leaves might have different cooling effects? Now that became a project. And 8 months later, they won a science prize at the national level for the project called the cooling effect of leaves. They found in that particular area, the peepal leaf provided the most cooling effect. So they went through that process of ah, aha, and ha-ha. Because once you open that gate of getting children, or anyone for that matter, to learn to question, Einstein talked about a holy curiosity. In fact, he said the reason for his remarkable discoveries was not IQ. It was curiosity, obsession, and dogged endurance, right? So the learning is, there are solutions. The new the National Education Policy 2020, I think, recognizes the importance of this hands-on experiential learning using technology in order to shift importantly from what to learn to how to learn. If that shift isn't happening, then it doesn't matter how much money you spend, what technology you use. After 20 years, you're going to say, hey, why didn't that deliver the goods? So transformation is possible. It's possible at scale. It can be done in an affordable way, provided you create environments that encourage people to question, to be curious, to discover, to experiment, and to have a lot of fun. If you can do that in your company, you do that in your school, you do that in your family environment. A lot of parents ask me, how do you get your child to be more curious? And I ask them, have you ever asked your son or daughter when they come back from school or college, what questions did you ask in school or college today? And they give me a blank look and say, never did. More often than not, I'm saying, what did you learn? I'm asking, what did you learn? And what did the teacher say? And what grade did you get in school? So it is being a tippy top, right? Inverting it and shifting from answers to questions. And that itself can bring about a revolution. I hope I've partly answered your question.
Wonderful. You did more than that. Yeah. Thanks so much. The entire fresh way of looking at the need for curiosity, at that dogged perseverance and obsession that Ramji talked about. Let us go to the third issue, and this is the tricky one, that of livelihoods. See, as an economist, and I can not stop myself from lecturing, but we always taught that health and education are public goods, and state should provide them clear accountability, what all of that. But what about livelihoods? Is the provision of livelihoods, is the guaranteeing of a job also a public? Is that also something that the state should provide? Do we have a responsibility towards that? And the strange relationship between livelihoods and technology. Does technology take away livelihood, or will technology enable new livelihoods? In difficult sectors, among people who have certain very built-in disadvantages and problems that we have created in our society, MEERA has worked with special children and youth for several years and has been able to answer this difficult question. In times, and this is a little more than the COVID times, where we have lost a large number of jobs, joblessness and unemployment is at its highest ever in post-independence. How do we get around this problem? And what has Youth for Jobs done to allow so many thousands of our youth to get respectable livelihoods? MEERA.
Thanks, Amir, for putting together such lovely co-speakers. I'm really fascinated by what the both speakers before me said. The whole work of Youth for Jobs and my journey is triggered by the fact, and it's a fact because enough studies have shown on my own work, that when you give a job to a young member of an underprivileged family, more so a youth with disability, it takes the entire family out of poverty in a sustained manner. And again, I see that it's not a question of just economics, Amir. Okay? What happens with a job is there's a whole range of social empowerment which happens, which perhaps you're not really capturing, because generally we're just looking at the rupees, how much income increase, he doubles the family income, etc. And let me give you a simple example. A couple of months back, I went to one of the television channels where we had placed a girl, and she stood up and she came running. I didn't recognize her. She stood up, she came running, and she said, "Thank you." I said, "Thanks for what? The training?" She said, "No, the job." She apparently, because of her job, imagine, she's a young girl with disability, okay, who would not probably have got married in the normal circumstances. She would have been an extra mouth to feed for the family, okay. Today, she's an asset. She's married a bank clerk. She's expecting a baby, and her husband was coming to pick her up on a nice motorbike, which I saw outside. So that's what she thanked for, the fact that a job has given her a status in society from being socially discriminated. And we know that the next generation of hers will be a generation which is closer to you and me, which is what we want in Indian society and actually globally. So talking about the use of technology, I worked at scale with underprivileged youth and jobs. But in the space of disability, I think it's much more important. For example, a simple solution is that all of us who wear specs, your eyes are somewhat disabled, so you wear specs. Okay. Uh, and this is becoming, disability is becoming more and more important because people are living longer and are getting disabilities. But let me tell you about the youth themselves and what happened in COVID, Amir. Um, Youth with disabilities, vulnerable youth are invisible in times of crises because there's so much to do, okay? So when we had to close all our training centers, the youth actually begged us not to stop our livelihood work. And we really didn't know what to do because till then we had something like 37 training centers in 18 states of India. They were all for the rural poor who would come in, everything was free, they were residential. So while they were going, they implored us, they said, listen, our fathers' incomes will all disappear in these times because most of them are marginal farmers or shopkeepers. So we just thought to ourselves what to do. And like you, what we did was quickly, we were the first to launch a grassroots online trainings for these youth with disabilities. It was amazingly difficult, let me tell you. Like the other trainers, our youth, our trainers also were not equipped with what online means. Okay. And in disability, there are various kinds of disabilities. So for the speech and hearing impaired, we had to do sign language videos. Okay. 102 videos to teach them also and make sure they were not out of the labor pool. But we did it. And the impact was just mind boggling, let me tell you. What actually happened was that we found that there were youth from such remote areas that sometimes we looked at the map to see where is this village, actually who were enrolling into this. Jammu and Kashmir, we had 19 students who had enrolled. Young widows and young women who otherwise would not be able to because they can't come to the residential centers, they had enrolled. There were 600 from the aspirational districts. The numbers of scheduled castes who were disabled increased by 28%, which means that these are the double discriminated. And you'd be surprised, our incomes of the jobs we gave increased. Now, how did that happen? We analyzed that was because while the retail and other jobs went, e-commerce jobs were the ones where we became the India knowledge partner for Amazon. Okay. Amazon, Flipkart, and all these give increased incomes compared to the retail and the other sectors. So in the hardest and the harshest of times, we turned an adversity to an opportunity using simple technology. And there's a lot of jugaad in it, let me tell you. Lots and every day was a challenge. And each trainer was, addressing it by themselves in very simple ways, which they can understand. What is more important is, I think this COVID time gave us all a good time to reflect. Okay. So we took the learnings from that and we said, till now we used to say with great pride, saying that, MEERA is obsessed with Bharat. We always do rural and underprivileged first, which is true. But we realized that there's a huge, vast, remote rural areas which we are not even touching. And these have to be touched. So today, on the basis of our learnings of COVID, we are launching the Grassroot Academy. We've completely putting all our learnings virtually on the head, okay? And we're saying, can we do of the disabled by the disabled? We're taking back our alumni who have a desire to give back. And remember, even the poor have a deep desire. In fact, sometimes I think it's much more than us to give back. So we're taking them back and making them the leaders of our livelihood programs in the state by taking them through a 1-year program. All things which we do for companies like our services, sensitizations, accessibility audit, we are completely putting it in vernacular and in simple manners. But one of the things which we are stuck with, which I was telling Ramesh, is, what is the kind of simple grassroots technology we should use to, which the executive can pick up through his tab and we can analyze to measure the socio-economic impact, because that impact is going to be mind-boggling. We are going to start working at the village level, a complete bottom-up approach, which has never been done before. And it's also of the disabled by the disabled. So the assumption is, like the child knows best, the disabled knows best about themselves.
Wow, wonderful. Thanks so much. And thanks for bringing up that point that, there are those who are doubly underprivileged, or triply so. First, you're rural, then you have very little access to public services, and on top of that, you're disabled through various ways. To reach out to them, you're absolutely right that most of us haven't looked beyond urban and peri-urban areas, and that itself is a universe to look at. So thanks for bringing that point out too. We are running out of time. So what I'm going to do is go over to all of you, or some of you, actually 3 of you. Any 3 of you, one question to one panelist, please. Healthcare, education, livelihood. If there is anyone here who has a specific question, we just have time for one. So a quick show of hands. Yes, please. No, you have to be, yeah, you're loud enough.
Everything beforehand. Why do we wait till that hits it, like we had during the pandemic? Like when I work for Sakina Foundation NGO, I work with TRS, I work with Hyderabad City Security Council. So every sector I work with had the inch and the pinch. Why didn't we do this before, as said by the speakers here? Now also we got to be prepared, because COVID-19 has taught us that we need to have our civic sense ready. And always we need to compete not with India, not with US, but we got to compete with China, because that country, it's teaching us where we land and where we have to land. Okay. So this is something very important. I need to know this.
Thanks.
Thank you.
So why aren't we prepared, especially on the healthcare? Why are we reacting to pandemics? Anyone else? Do you have a question on education? I had a question, and this I put across to Ramji, that Ramji, on the education front, we found that the data shows that we've had a record number of dropouts. The UNICEF measures it at 25 million, most of whom are in India, and most of whom are possibly never going to come back to school ever again. So is there something that we can do for them? And for MEERA, my question is that, MEERA, how do we raise the level of the livelihood challenge? Education is something that we are all very fond of. If you look at any philanthropic data, you will find that most of our money is spent on education. Even if you look at India's budgetary expenditure, we spend about 4 times on education than on healthcare. Right? We want unhealthy graduates, so we do we do spend 4 times that money. And everybody, so education is easy. Health is difficult, but livelihood, nobody cares. How do we get people, which means private donors, governments, private sectors, to consider that livelihoods. And that point that she made, that livelihood is not just a vocation, a job. It's the entire shift from poor to non-poor, from marginalized to non-marginalized, from vulnerable to non-vulnerable, from underconfident to supremely confident. That is the power of providing livelihood. So how do we do that? So can I first get to Manoj to answer Sophia's question?
So, the why we are not prepared for dealing with some of these issues. I think quite often when you see in health sector, we have been quite a lot disease focused. You have a TB, you have a TB control program. You have an HIV, you have an HIV control program. You have anemia, you have an anemia control program. But I think maybe 10 years back when we talked about investing in primary care, I think we hardly had takers. And even now, the primary care system is the weakest link in the whole system. So if you have to really look at pandemic preparedness, first thing is the surveillance mechanism, community level surveillance mechanism to track what's really happening. I think we have to really start building from there. At least in our work, now we are working with the government. All the focus is now on enhancing pandemic preparedness. How do you up the critical care capacity? Tertiary care level, things will be more or less done is my assessment, but we will still struggle at the primary and secondary level unless we have some coordinated action taken quickly.
Ramji, your 1 minute, please.
Yes, I don't know that there's a silver bullet. One is you have to make traditional education more magnetic, more interesting. If the aha, ha, ha is missing, then even if you get them back to school, all you're producing is a bunch of people who are not able to think. Now, with the new education policy, at least at the policy level, there are lots of opportunities to give more freedom to schools to actually discover, experiment, and make learning more fun, relate it more closely to real life problems through projects and so on. So that needs to happen in spades, okay? The second thing is for those who, for economic or other reasons, are not likely to come to school, it doesn't matter how exciting school is.
Yeah.
For those, you have to find ways of taking learning to them. So, for instance, in Agastya, years ago, we launched a mobile science van that actually takes science experiments into the villages. We do experiments at night with the whole community. We have night school visits where we encourage children to do a lot of activities. So you can also leverage technology in order to take learning into the villages. For instance, during COVID, because children couldn't come to school, besides technology, and then the majority of kids don't have access to technology, we created a home lab kit, and then we created a very exciting activity-based learning book where you can make things out of paper sitting at home. So that's powerful learning. It's probably more powerful than sitting in a classroom and listening to a lecture.
Yeah.
So it's a combination of such things, making traditional schooling far more magnetic and exciting and relevant, and taking learning into the villages or into the towns to the doorstep of future learners. And, national open schooling was something that was started. Maybe we'll have to look at that and see how we can make that more powerful. So it's going to be a combination of things.
Thanks so much. Thanks, Ramji. Meera, how do we elevate this livelihood issue?
I think the first point, Amir, is that we should stop thinking education and livelihood are not linked. Especially in higher education, the more educated you are, the more unemployable you are. And we constantly, in our College Connect program, which we just launched, we just struggle with them because they are engineers who know absolutely nothing, but their aspirations is that they'll only get into a multinational or a Infosys. So we really struggle with that. So that I think everyone has to realize that there has to be this link between an education and the livelihood. The second about investments, it's interesting. I think the ESG is bringing a focus on vulnerability. For example, tomorrow at the UN headquarters, at the largest conference, I'm taking 2 sessions from India, coordinating them, which are on the investors who are the startups in the disability space, including a fireside chat with Dr. Rajiv Kumar, your friend of Niti Aayog. Okay. And the investors are becoming interested in the space and actually asking me if I can help them create a silo around this. So I think these are good times where if you, I mean, much more can be done, but I think the spirit of interest, if you can kindle it with people like Ajit, who's sitting over there, who's a big supporter of our work, I think that gives you hope.
Dr. Khan, if I may, I just want to make a quick point.
Oh yes, please. Yeah.
Because many people have asked, why is it that we don't anticipate problems? You know, Chanakya apparently famously said, you must sweat during the peace so you don't bleed during the war.
Yeah.
Okay. You must sweat during the peace so you don't bleed during the war. We all quote people like Chanakya. I think we need to reflect on statements like that to understand what it implies, what it means. I know in the case of Agastya, a big learning was we came out very resilient through COVID because we had sweated for 20 years before COVID.
Yeah.
And that enabled us to respond and do better. So let's reflect on that, because that seems to come up again and again of why do we keep reacting to problems and not, you know, be well prepared to deal with them.
Thanks so much. You know, we've run out of time completely. Thanks so much. I must, and I've stood up to tell this to you. You know, hope really lies in this auditorium. For a long time, we have believed that we are working on technology. We are producing technologies who have no connect with society, and therefore the wonders that they do in their labs and in their colleges do not reach out. It is so heartwarming to have a bunch of you gathered here to look at issues that that honestly, that typically do not concern you. I mean, you're concerned about your courses, your credits, whatever you patent at the end of the day. But to step out and to understand and to be sensitive to human problems, to human suffering.